The Region 6 COVID-19 Task Force held a meeting earlier today at which the Regional Health Officer reported 441 positive cases in the region to date. Renetta Court reports.
Earlier today, the Region 6 COVID-19 Task Force met at the Region 6 RDC's boardroom to report and discuss matters in relation to the COVID-19 pandemic. Regional Health Officer Dr. Vishalya Sharma, while addressing those present, reported that in total, the region has recorded 441 positive cases of the coronavirus, with 403 recoveries and 9 deaths. 137 of those positive cases were recorded this year.
Our active is at 37, Curtin has 2, New Amsterdam 18, Kanji 7, Quarantine has 10. We would recall from the last time we would have had an active of 65, so it's now at 37 within the week. So we're really hoping it continues to drop over the course of the next couple of days. But I'm happy to report our active has decreased by more than 50%. This is our epidemiological curve as of February. This basically represents the total number of cases. You would see, as it's illustrated here, in November we would have had that 184. January was our second spike at 122, and we're down to February.
She further added,
we would have had increase in cases in Oriala. As of today, we would have had 13 positives in Oriala and 4 in Siparuta. 45 swab done in Oriala, 30 in Siparuta, 4 positive. All the patients from Oriala and Siparuta has been discharged at this point in time.
In 2021, 612 tests were conducted thus far, which is due to an improvement in testing materials, according to Dr. Javid Aziz.
And more efficient. Better response from the National Reference Lab because they don't have a backlog right now. Sometimes if we send the results in the morning, we get it back in the evening. So it's more efficient because we get to capture the cases earlier and avoid them spreading it out there. And also we have been using the RDT antigen testing, especially in the hospital testing for patients who are symptomatic and active. So we get back those results in more or less 20 minutes.
The Regional Health Officer then briefed the gathering on actions taken by the Regional Health Service to curb the spread of the virus.
We have in-house training continue across New Amsterdam. I mentioned earlier that Dr. Lord currently conducted training at the National Psychiatric Hospital. We're concerned about that, the fact being that patients will come from Georgetown there. So one of our work plan is to strengthen our response there. During this week, we would have donated some supplies to prison. We would have also swabbed all the students that would have started at Guyana Training College. Our course storage was about 75% completed, and we would have had through the Ministry of Health our course vaccination training of the nurses. We would have also had yesterday an engagement with the primary healthcare doctors to brief and strengthen the vaccination response in 6. We would have also put systems in place to operate outpatient at New Amsterdam from 4 to 10 in the night.
Finally, Sharma called on the general public and the business community to pay heed to all COVID-19 protocols.
At this time, we'd like to encourage the business population again that once there are positives reported, please start engaging the regional task force. It's nothing to panic about. We will get there and do our necessary surveillance and sanitizing. At the same time, urge the residents of Region 6 to continue adhering to the guidelines. It's absolutely important for us to have a mask on always and follow the social distancing guidelines.
Reporting for Channel 8 News, Renetta Court.